Hi guys, my name is Ruth. I am the PGY2 Ambulatory Care Resident for Touro University. My primary practice site is the Sharpley-Steele Medical Group located in San Diego, California. The medical group actually has several clinics located all across San Diego County. Core rotations for the residency include primary care, cardiology, endocrinology, and pulmonology. There are also several electives available, including rheumatology, allergy, infectious disease, and several others as well. And as opportunities for new electives come up, they're constantly being added. So there's always the opportunity to branch out and do more. The patient population ranges. The medical group does accept most insurance plans, so therefore I can see patients who are Medicare, Medi-Cal, all the way up to privately insured patients. A typical day for me in clinic would probably involve working at patients, flagging any sort of drug-drug interactions, going through the progress notes, going through the labs, checking if the immunizations are up to date, just really flagging what needs to be done for the patient from a pharmacy perspective. And then when the patient comes in for their appointment, I'll typically talk to them first and do any med recs needed, and then discuss with the physician what our plan of action is and how we should move forward in the care for the patient. At a bare minimum, I'm also involved with smoking cessation classes that are offered through the medical group once a week. On top of that, you can also choose to be involved in any other sort of education class that the medical group provides, including any sort of diabetes education classes, gestational diabetes, New Start insulin diabetes classes, asthma education classes, so on and so forth. I chose the program primarily because it was a great medical group and a great site to be at. We do have an EHR that spans across all Sharp healthcare. So if a patient is hospitalized and discharged, I'm able to access their inpatient records, which is very helpful. Or if they switched PCPs, I'm also able to access what their previous PCP had documented for them for the previous few years. So that also helps in terms of continuing care for the patient. And then also the program through our director, Robert Schoenhaus, provides a lot of flexibility and a lot of support. They are able to provide a lot of insight into how and why we choose to approach certain physicians or the best way to really interact with our patients. So that to me was very important in helping guide me through the year as well. So hopefully I provided a very brief but very comprehensive overview of the program. If you have any further questions, please feel free to contact me and I'll get back to you as soon as I can. Thanks.